what's important about the anterior approach is that it's a minimally invasive surgery in that means you're causing less collateral damage to the surrounding soft tissues. There's a group of muscles in the front of your hip that we are able to open rather than dissect through or cut.
When I was told I had to have my left hip replaced, I had talked to a few people and everybody had told me, get it done in the front, do not get it done in the back. It's too invasive, they cut through too much stuff, where in the front they just move things out of the way and you're going to recover a lot quicker.
The main advantage in not cutting muscle is the amount of pain you're going to have after the surgery. People are allowed to move their hip in any position they would want to do, whereas some of the more traditional approaches, you'd be asked not to bend over greater than 90 degrees. You'd be asked not to cross your legs at the ankle. You'd be asked not to rotate your foot too far outward because of the risk of dislocation in the early postoperative period. When I do an anterior approach to the hip, I've had people behind the wheel of their automobile in 2 or 3 days. The way I used to do a hip replacement required people to use a cane for 6 weeks or more. So with the anterior approach, I might have someone on a cane for 7 to 10 days. So going for a walk in the woods without an assistive device, being able to go shopping, to buy food and, just the little things in life, to be able to climb stairs without worrying about using a cane. So, the anterior approach has people doing all those things in a rather short order compared to the more traditional approaches.
The biggest and most amazing part of the surgery is that I am living life again. To get up and get out of bed and walk around the house and do my house cleaning and visiting people, it's been life-changing for me.
There are very few surgeries that get people back to their quality life as quickly and as easily as hip replacement. That's why I love it as much as I do, is because the return to function with hip replacement exceeds almost every other surgery you can think of. And that's what makes it so great. That's what is so rewarding for me as a surgeon, is to see people returning to the activities that they hadn't done in decades. And that really is the difference at Griffin Hospital.
Griffin Health, empowering people, advancing care.